Okay, Pooja Ji, you can start with your presentation.
Jai Jinendra, thank you so much for that patience early in the morning. And I'm sorry for the last minute. I didn't know that I had to inform. I'm sorry. Imagine you are sitting in a dental chair. आप सब लोग dental chair पे बैठे हैं or you are at a dentist. You are afraid your tooth is hurting. The dentist picks up a tool, a drilling tool. At that moment, who are you? Are you just a mouthful of teeth or a living soul bound by karma, seeking for relief? Can we imagine that? Today, I want to show you that Lord Mahavira did not just speak to the monks, he spoke to every dentist, every patient, every suffering jiva. Everything Jain metaphysics teaches us about soul, karma, liberation, non-violence. A dentist lives it every day. As a dentist, I see it every day. After learning metaphysics, I see it more deeper. Huh. Look at this particular thing, how I am going to compare the real part of dentistry with that of Jiva, Pudgala, Dharma, Adharma, Akasha, and Kala. Here, the soul is the living patient, the nervous patient on the dental chair. Pudgala is the matter, anything that is physical. The tooth, the drill, the x-ray, everything around the Jiva is Pudgala. Dharma, I would compare to the saliva in the mouth, the Gati Sahayak, which is there inside, which helps me glide the instrument through the tooth. It helps me move the instrument, but it does not facilitate my instrument. I have to move the instrument. But then it helps, it only seeks helps from there. Adharma, medium of rest, where here, when I deposit local anesthesia in one of the tooth which is hurting for a patient, the patient remains still there. This deposit of local anesthesia in that tooth is helping the patient stay still. That is Titi Sahayak. The Akasha is the operatory, the dispensary where I'm working. And the Kala I compare to the appointment timing, the decay timing, and the healing time, what a patient looks through. This is what I told you all about it. The soul, the matter, the medium of motion, the medium of rest, space, and time. Jiva is compared to the infinite potential what a patient has, infinite consciousness, infinite bliss, and everything within that. But when the patient comes to me, the tooth is not the jiva. Though the tooth has the nerve in it, I would consider that jiva is not the tooth, it's the pudgala. Here, I would compare the soul with that of the tooth's plaque. Say karma is the one which binds to the soul and plaque is the one which binds to the tooth. For all of us to understand what is plaque, plaque is a biofilm. जब हम ब्रश नहीं करते हैं 2 दिन के लिए, तब जो slimy structure, the sticky structure which forms on your teeth is that biofilm which is called as plaque. Now, how does karma bind to the soul? It's due to the mental and emotional states, or through the bad thoughts, good thoughts, or through good actions, or through bad actions. The same way, if we don't brush, the bacteria starts building up, the sugar tries to get attracted to the bacteria, and the bacteria releases a toxin which makes the plaque. That is the biofilm. Now, what happens next? The brushing does not happen every day. So layer by layer, karma is getting formed, which is compared to the layer by layer, the plaque gets formed. This causes suffering, disease in the next life. That is, it grows thicker and thicker with each bad action. That is, the karma becomes layer by layer and thicker on one's soul. Similarly, I'm putting that analogy to the decay which happens and goes deeper into the nerve of the tooth. I hope all of you are following with me. I know it's a little technical, but I'm just trying to keep it very, very simple. I, as a dentist, see it every single day in this form only after learning Jain metaphysics. Now, how do we remove the karma? We remove by doing tap, austerities, and the right conduct. But how do I remove the plaque? It's by brushing, flossing, scaling, and then cleaning the tooth professionally. If I ignore by not doing any tapas, then I am looking at a bigger form of karma binding over me. And the same thing, the deposits become harder. That's called tartar deposits. The yellow thing which gets stuck to the tooth is called calculus. And removing that becomes really tough. And the same thing is compared here. The more karma you bind, the more layer by layer gets fixed, and the more thicker layer gets fixed, and it becomes really hard, just like a dentist finds it hard to remove the calculus from the mouth. Now, how does a liberation happen? By freeing yourself, by doing nirjara. And how is a nirjara happening on a dental chair? By removing the plaque professionally with the periodontist coming into play. A periodontist is nobody but the gum specialist who takes care of it. Just as the dentist removes plaque to protect the teeth, spiritual practice removes karma to liberate the soul. Now let's look at Anekantavad, the doctrine of many-sidedness. How is that one tooth is being judged by different specialists? How is that blind men judge the elephant? How well do one person, one perspective join together and become Syadavad, becomes seven ways of prediction, and then becomes a definition of one thing. The radiologist sees the tooth and says that, yeah, there is a bone loss. This tooth needs an extraction. What does the family say? No, no, my child is young. I don't want to get the tooth removed. I want the tooth to be there. How can we save it at the best cost? What is the patient's view? He says, no, I want to save the tooth, but I don't want any kind of pain there. Can you please make my tooth feel fine? And then the endodontist, the root canal specialist, says, it's nothing. It's just the pulp. The nerve inside the tooth is rotten. We need to do a root canal treatment. Looking at all these views, everybody is right in their perspective. But when you culminate all these things, you are actually getting a better definition, better point of view. Anekantvad in Jainism teaches all perspectives hold partial truth. I, as a clinician, look at every perspective, listen to them, absorb it. And this particular semester has made me more involved into what is other people saying than giving my own decisions and making the line of treatment by my way. I now look at it in a different form, in a different perspective. Listen to every specialist perspective so that I end up being on the right conduct and giving that right samyak charitra to the patient and doing justice to the patient by listening to every aspect. So Anekantavad on my daily practice has helped me do much better and bring in a lot of love from the patients to me. Now, this is the sevenfold prediction, what I said, Syatasti. In some way, it must be right by the radiologist. Syatanasti, in some way, it may not be right. Syat asti nasti, in some way it is or it is not. So this way, there are different permutations and combinations where our literature talks about Syadva, the sevenfold prediction of any truth. There are thousands of prediction, thousands of people, but all of them fall into the sevenfold prediction makes the definition of what is actually happening around us and what is the real thing. To define what is real thing, it is important to have the base of Anekantvad and also to know the sevenfold prediction. And only then an individual, a jiva, can see the truth behind what is the real thing. And all this is based on the seven realities, that is the seven tattvas. Now, before going into the seven tattvas, I will take you through this ahimsa that becomes a central philosophy of Jainism. Nonviolence has actually been a part of every dentist's life because every time a patient walks in, he has the bacterial inflammation, which makes the patient feel the pain because the bacteria are releasing the toxins, and because of which probably a patient is going through the Vedanya karma, probably Asata Vedanya karma more precisely. And at that point of time, what is that dentist trying to do? He's trying to give the antibiotics and kill all those ekindriya jivas which are trying to proliferate and try and multiply there. What else can a dentist do? I need to do that to kill those microorganisms which are causing trouble to the patient. I always think that am I doing the right way? Can I think? And yesterday when this conference by Singh Sir ji jo hua tha, it was all about non-violence. But how is a medical practitioner going to do it? It's a big question mark behind my mind. I left this question on the chat box to know how is that a dentist or a medical student would do it. For me, doing this is just trying to implement what is right in my practice and what is that best way I can build up the practice of ahimsa or the practice of Jainism or the practice of Jain philosophy in my day-to-day practice. Now, what is that physical ahimsa I would try and avoid to the patient? I would try and remove the tooth with minimal trauma to the patient. I would try and involve myself into minimum invasive dentistry, that if there is no removal of teeth required, even if there is a suggestion by another dentist, I would try and look at it to save the tooth and give less trauma to the patient. That way, the physical ahimsa, that is to the body itself, that ahimsa, I will not try and indulge the patient into it. I will try and call the patient to say that, are you okay? Before, after, during the treatment, my every question to the patient to make it feel comfortable so that I am following the physical ahimsa. No unnecessary tooth removal, which I already said. If anybody, even the patient comes and say, I am in a lot of pain, please remove the teeth. I will not, because removal of the teeth is a bigger pain than saving the tooth. Of course, it takes more time, but then it is much, much better for a patient on a long run. Mental ahimsa. I will not shame the patient, like how body shaming or shaming of any person who's not wearing the right dress. Similarly, I will not shame the patient by saying, what kind of dental health are you having it? What kind of tooth maintenance are you doing? I will not try and fear monger the patient for compliance. I will not say, oh my God, this is going to trouble you and this is going to really hurt you. You need to do something. I'm not going to give that mental trauma to the patient. I will try and be compassionate to the diagnosis. My diagnosis will be the right way. And this is how I bring in justice and try to bring in that right conduct to the patient. And this is how I think all of us should be when there is somebody who is in mental trauma. We are not inducing the mental trauma by saying, oh my God, you haven't studied anything for the exam. No, we are not doing that. We are just trying to say that, okay, it's fine. You have 7 more days to do it. You have 7 more days to do wonders for your exam. And that is what is a mental trauma. We do it most of the times unknowingly, but having that consciousness to know that what is that word which I will try and spell it out, and what is the other person going to receive it, and what kind of mental trauma that's going to do. These are small, small things which I think I have started inculcating by doing the right way. The verbal ahimsa. I don't use strong languages in the clinic. I would explain very calmly without losing my patience. By God's grace, I think I have been given this immeasurable quality in me, the patience which I have. And I don't blame the patient for their habits. There are a lot of patients who come with a lot of gutka chewing or kind of, smoking or alcohol addictions, but I don't blame the patient because it's their situation. They don't know what they know what is their gravity. They know why they are taking that gutka. They know what kind of kick they get. But I have no right to judge the patient and say that, yes, this is what you have done. Or any alcoholic patient around us, we or any alcoholic individual around us. Let us take on a general blanket statement. Anybody who is doing smoking in front of you, who's doing gutka chewing in front of you, or who's trying to do any kind of obscene in front of you, we are nobody to judge and verbally say them. We are all here to follow ahimsa in the smallest way. Not killing an ant is not the biggest ahimsa we do. It is this ahimsa. This ahimsa is towards those Panchendriya Jeev. Only Panchendriya Jeev are going through that physical, mental, and verbal trauma. And we have to look into it. And I think I have tried to look into it with this particular course which I'm learning. Now, the stages of spiritual progression, the Gunistan, I have tried to, relate this with the dental part of it, looking at from the lens of a dentist. One who ignores oral hygiene is nothing but into the wrong belief, into the no spiritual awareness. Next is the fourth Gunistan, where right belief but no vows are yet. You believe in what is right, but you do not follow the vows, what you're supposed to. The Mahavrat and Anuvrat comes here. That is, you know what is brushing, how is it going to help you? But you are not brushing. You're not doing that right form. Deshavarat, where you follow partial vows and ethical life. You brush once daily, but you avoid sweets partially. Similarly, the Gunisthanak positions have been compared to that of the dental thing. It's too much dental, but I just found it very interesting to mirror it in the oral health journeys. It was very interesting for me to make this particular slide. Now, what is liberation of soul? Complete understanding of patient's oral health, no hidden disease, that is Ananta Jnana, infinite knowledge. Ananta Sukh is that pain-free moment the patient goes through, the confident smile the patient goes through, the psychological comfort, which I think is very difficult to touch upon, is what is restored, and that is infinite bliss. The patient goes with that beautiful, confident, and that smile and taking that quality of life and feels in harmony with the other people around. Say if the patient doesn't have a front tooth and I give the patient a pain-free front tooth replacement, he would carry that confidence of smile, he would carry a good quality of life, and he would also feel harmonized in between the patients or in between the people around him. I've had patients congenitally having no ears, or some patients who are not blessed with an eyeball. So what I do is I do prosthetic part. I try and give artificial replacement. They do not function. They do not provide any kind of vision or any kind of hearing to the patient. They only give artificial replacement. It's only the Pudgala matter which I'm fixing it. And what am I doing by doing that? I'm trying to give that psychological comfort. I'm trying to make the patient not feel bad in between that crowd where it is going, and I'm making patient feel that confidence by people not blaming the patient, saying that, oh my god, this patient does not have a ear. I'm giving that replacement, and that is what I feel I am implementing by giving that Ananta Sukha. Of course, it is the liberation of soul. Of course, it is related to the soul. But then, how am I practicing towards it? How am I looking at it? Perfect diagnosis, every issue visible and addressed. I do not leave, even if there is small point of thing which I feel I am not perceiving it rightly, I would call upon another specialist. Similarly, if we have any problems and we are unable to diagnose or we are unable to face that problem, we have our teachers to help us. We have our elderly people who have already done it, but we do not have to feel that where is that one thing which we are missing and we cannot go ahead with those missing things. We really need to take help. And taking help helps us giving infinite perception to ourselves as well as to the soul. And now this is all related to the soul. I am just trying to compare. The Ananta Virya, I would give that energy to the patient by giving them full function of teeth, which will be making them able to eat, speak, smile without any limitation. What is that limitation? A lot of patients, when they don't have a good set of teeth, they would try to put their hand on the face and say, ha, ha, ha. No, that's not what I do. And that's what it says, that liberation of soul, moksha, is only when you let go of everything, all that part, and then you enjoy or perceive this ananta gyan, sukha, darshana, and virya. Just as moksha is the soul's highest state, free from all karmic disease, complete oral hygiene is the tooth's liberation from decay, pain, and dysfunction. Coming to paryaya, the modes of change, nothing stays same. A teeth, which is compared to soul, no teeth, which is compared to no physical karma yet. Then you have the child going through at birth. Yeah, so let's compare this with a little more simplified part. If you can go through this flow chart, at birth, the child has no teeth. So there is no physical karma yet. So it is born with a clean slate. Do we believe in that? No. We know that at birth, the child or the jiva is carrying a baggage of karma. Yeah. But still, the baggage of karma is its last janma's karma. So this Janma, he still has no karmas which has been binding yet, which will come in the way. And that is what is compared with the teeth. So the moment the patient has the teeth, born with no teeth, and then it has mixed dentition, that's a transition phase. The baby teeth goes away, the new teeth comes, and adulthood teeth from 20 primary teeth to 32. So we all have 32 teeth. These also get ripened. These also lose. These also go in for wear and tear. At one point, when there are no teeth, that is considered to be liberation. That is your completely to a zero karma, infinite consciousness. Now, from birth to the death, the teeth is going through a lot of changes similarly. Every dravya is going through changes. Every dravya has to go through changes, permanent changes or temporary changes. But end of the day, the particle, the pudgala remains there. It still stays there in the akasha. Utpadavyaya Dravya Yukta Sat. Reality consists of origination, destruction, and permanence. Every tooth, every soul is in constant paryaya. Samyak Darshan, Samyak Jnana, and Samyak Charitra are the three jewels to path of healing. Now, to just relate it with from the dentist point of view, correct understanding of the nature of reality and the soul trusting that liberation is possible. This is Samyak Darshan. You perceive it. You know that right faith that we are going to get that liberation if we are going to believe in the nature of reality. What would a dental point of view say? Patient believes their oral health can be restored. Without this faith, they won't come back for a follow-up care. If the patient is completely not understanding that there is no faith to the dentist, then they will not come back. Similarly, we need to have faith saying that there is nature of reality. There are layers of karma which are binding over the soul. To trust this, you need to have the right faith. And that is what is Samyak Darshan. An example to the dental related part for Samyak Darshan is a phobic patient who finally believes I can have painless dental experience. That belief changes everything. Samyak Gyan, accurate knowledge of seven realities, and that is what the base lies in. And that is what brings us to the liberation. Now, what does dental point of view talk about? Patient understands what is that gyan to get through the x-rays. They get through the depth of the pockets which are formed around the gums. They know that decay severity and why do they need treatment for each. And this is what is gyan on a dental note. And if you want to know about the Jain Gyan, what does it say? The accurate knowledge about seven realities is what is the right knowledge. For this, I would just bring in one of the examples. When the patient sees their own X-ray and understands bone loss, they are more likely to pursue periodontal therapy, that is gum therapy. They understand. because we have the right knowledge. And similarly, if we have the accurate knowledge of seven realities, nobody can stop us from breaking down the karma, which are binding over the soul, and nobody can stop from what is within us. That is a liberation of our own soul. It is not nothing that we are getting something new. It is nothing that we are getting awarded. It is within us, and that is what we need to understand. Samyak Charitra, living according to the ethical vows, the Mahavrat, and onwards according to layman and the ascetic being, that is the Mara Sahib. Ahimsa, truthfulness, non attachment, daily practice of liberation. Similarly, if I compare to that of the dental, consistent oral hygiene, brushing, flossing, diet changes, you don't eat sweets, and daily action towards the health. And these actions, what we follow, is what is going to give us the right conduct. The patient who changes their nighttime brushing routine, brushes after sleeping, embodies Samyak Charitra in dental form. I have just compared. Now, end of the day, as a Jain, what is the right conduct? Doing the right way, wherever we are. If we are trying to listen to a person, our buddy friend who is in real tears, we need to be there. We can't look at saying that, okay, I have something else to be lined up for me. I need to go. No, we're not doing right to that individual. That is what is right conduct. What is right for that time? If there is a person who is suffering your own kamwalis at home, your domestic help at home, what is your conduct towards her? By not giving thousands of rupees to a temple building, but it is Panchin Rajiv next to you who is suffering. What is that conduct you're going to do towards her? Do right thing. She needs money. Giving money to different places rather than giving money to somebody who is suffering right in front of your eyes. Or give her that feeling that, yes, we are there for her. Well, this is more controversial, but then Samyak Darshan, Samyak Gyan, Samyak Charitra, there are n number of predications, n number of ways to look at it. As a dentist, I look at it and then I see that yes, the path to liberation can happen in any route. I take a route to Bangalore and to any place by airways or by roadways or by railways or by walking. It is my way. But Samyak Darshan, Samyak Gyan, Samyak Charitra, of course, leads us to one way and one goal, and that is what is liberation of soul. So everybody, wherever they are practicing, whether you're a dentist, whether you're an engineer, whether you're a medical form, anywhere. These practices are very easy to inculcate and implement. Of course, one has to do image analogy to understand more deeper. Aparigra, non-possessiveness, to cut the long story on the slide, I would say that if the patient needs one particular treatment, I wouldn't overprescribe. If you're overprescribing, you're looking at the revenue which is getting generated. I would not generate that kind of revenue because that is again binding me to the wrong karmas, and that is binding again to the soul. So if the patient needs minimum amount of treatment, if the patient is able to do it, then we are looking at, or I as a person or my team as a person would look at giving the lowest form of treatment, the least revenue. That patient may not give me revenue, but then eventually I am looking at revenue for my soul. And this again is comparing to the Sapta Tattva, that is seven realities to the dental eyes, the conscious patient, their fear, hope, and identities towards Jiva. The Ajiva, the teeth, instruments, X-ray machines, materials. Ashrava, the sugar, neglect, smoking, neglect of all the good habits is completely neglected. There is where it causes decay, and here is where the ashrava, there is karmic influxes. Bandha establishes cavity, bone loss, all these things which changes on the tooth is nothing but bandha. The karmic bondage has already happened to the soul. Samvara, stoppage. How would you stop? Stop eating sugar, stop getting into the wrong habits, and try and develop a good hygiene practice. And that's how you stop. That's how samvara happens. That's how you're going to stop the influx of karma. Nirjara, how would you shed off? You would go to a dentist to shed off all that scaling deposits, decay, all that. And how would you shed karma on your general note on a Jain philosophy? By not doing the wrong things, by trying and doing a lot of tapas and austerities to shed off those karmas. And finally, we all get to the path of liberation, and all of us are hoping to go there. Well, the healthy disease-free mouth is what on a dental idol is the moksha, and that is what is compared here. And this is how I understand through the literature what is being studied throughout. Bringing all together Jain metaphysics as a living philosophy for dental professions. The highest form of dental care is one that honors the living soul behind every tooth. I would see not just a tooth, not just what the line of treatment is. I would see that there is a soul behind that. And I need to do right to that soul. And that is what is the right way. Jain metaphysics reminds us every healing act is an act of ahimsa. Every patient is a jiva on the path to wholeness. And thank you so much.
Thank you so much, Pooja ji. I must say that it was very creative and very enlightening kind of presentation because we got to know a lot of insights. We have never compared like both these professions. I mean, metaphysics to this profession of dental. It is quite challenging to even think about it, but you have did it very well. And again, a lot of questions coming to my mind. But yeah, before that, I would like to ask others what they feel, what they think about your presentation, and then we can move towards the question answer round.
Yes, ma'am.
Yes.
I have to stop
अच्छा
sharing
था
it.
मैडम अच्छा अच्छा था मैडम हाँ, मुझे तो ऐसा करना नहीं आता पूजा जी अच्छा प्रेजेंटेशन किया वो प्रैक्टिकल एक्सपीरियंस है वो डे टू डे क्या करती है उसके डेंटल शॉप में उसका उसी को वो कर्मा से रिलेट कर लिया सिद्धांत से जैन सिद्धांत से
नॉट
अच्छा था
जस्ट कर्मा, मुझे लग रहा है कि उन्होंने सारे ही
सारे
थ्योरीज
हाँ
को
सारे
कवर कर लिया
हाँ अहिंसा
ए टू
परिग्रह
जेड
सभी
पूरा।
तत्व हाँ तत्व सब भी
हम्म,
लिया है 7 तत्व भी लिया है वो अपन अणुव्रत वो है ना वो ही इसलिए है फिर
अनुव्रत,
अनेकांतवाद लिया है
अहिंसा,
अनेकांतवाद लिया
निरंकार।
हाँ
हाँ,
संवर्णित सब भी लिया है अच्छा था मैडम
यस।
आजकल के लोग कैसा कैसा करते हैं देखो हम तो छोड़ हो गए मुझे ऐसा थिंकिंग भी नहीं आता ठीक
So
है
it's
मैडम
good. Now we are
हाँ
getting
गुड
so
गुड
much of reflections through our
हाँ मैडम
everyday's life. How we can think about Jainism in a more detailed way
हाँ
to the
मैडम
core level. मतलब सीट लेवल तक कैसे जाके उसको देख सकते हैं, कैसे उसको जान सकते हैं. So that insight we needed because all things are available in text, ना सब कुछ है text में. But unless and until we start applying it in our day-to-day life, it is not going to be helpful for us. And that is, I think Pooja ji has done brilliant job by inculcating the things from our text to our day-to-day practices. So I really enjoyed it. What about Anil ji? आपको
हाँ
क्या
मैडम
लगा presentation के बारे में?
आप खुश तो बहुत होंगी पूजा जी because you have done very
बहुत
right
अच्छा
thing,
था
very
बहुत
good thing, and it was a actually practical application of the principles. I grasped in this way. I mean, it was really fantastic, and I feel we have heard, we have listened, and we have, I mean, we have followed the Nirjara and Samvar by the example of the boat and boatman. Now
Yes.
onwards, we can go about Dr. Pooja and the
Areva.
recommendation of that. I mean, we can see that purview. But here, only one thing was striking to me. I mean, it was a very good example, everything. But the example which you have given, that the plague was covered the teeth. The teeth is a pudgal, and the plague is also a pudgal. So you were combining the pudgal with pudgal, while we should, anyhow, we should, I mean, take into the account the soul and the pudgal. I mean, but
Yes.
when you have also spoken, you have also saved yourself because you have seen the tooth as a soul of
Yes.
that man. I mean, when you look at that point, it is all right. But again, basically, I mean, it hurts that you are covering pudgal with pudgal. I mean,
Yes.
Yeah,
I mean,
I don't know.
I got your
exactly.
point,
I
sir.
need
When I
your,
was doing
I
that,
need
I
your,
thought of it, but then
I
I didn't get
especially need
any other
your
example
comment.
to explain it. Yes, you are actually picking up the right point, sir. I mean, I was trying to compare, I mean, doing Pudgal with Pudgal, which is supposed to be a Jiva. So I considered the
Yeah.
tooth, which is actually a Pudgal, but yeah, but I could only
Anyway,
relate
but
it this way.
it was looked into other way. I mean, Anekant. So it
Yes.
works. No
It can
problem.
be connected to the punya and papa also. Like you are mentioning that you, if you're collecting the plate, then it is obviously the pap. It is not going to help you. But if you're just avoiding the unhygiene products or other things, then it is collecting of the punya. That means your tooth is all fine and it is not collecting the dust and the plaque. So I think you can connect with these principles also, the punya and pap. And obviously, the matter and matter principle is something new itself, like connecting the matter to the matter. Now we can think
Absolutely.
about it in a more detailed way.
She has
Yeah.
covered almost all the ingredients of the Jain philosophy, Jain metaphysics. You have covered every point, so I must congratulate you. But there is a question for you, Dr. Pooja, that suppose somebody comes to you and you diagnose that this problem maybe crop up after 7 months, or I mean after 6 months, or I mean let us say after a week. If you feel that he is going to have a serious problem after 7 days, but you process him, you do the processing at the same time, because it may drop off after all after 7 days, and he will be suffered by too much by that points. So if you do that action, that processing you do right now, whether this is Udirna or Samvar, you got my point?
If I'm doing it right now, I think it's the
It's
Nirjara.
Udirna or Samvar.
Yes, it's the Nirjara. If
It's
I'm
not
not wrong.
Udirna. It's not Udirna.
Sorry, come again. You told me whether it is Samvara or Nirjara, correct?
No. Whether it is Udirna, because you must have drawing the karmas before time, before it ripes. That is Udirna. So you will call it, I mean, you will put in section of Udirna. You know Udirna, no?
Yeah.
When we
I mean, very little.
when we ripe up the karmas before it comes.
Yeah.
Yes.
So-
So I would put it on the category of Udirna for sure, that I'm stopping that karma to right away come in there. So the Samvara comes in place, sir. So Udirna say Samvara. So I'm trying to correlate both of these for what question you're asking me. So I'm going to stop the karma which is already, which is going to come, and I am predicting that it's going to be there. So I'm procrastinating
Nirjara.
it. Huh?
It's not Nirjara. Is it Nirjara?
So eventually
or
it's going to be Nirjara because I'm going to remove all the bacteria from there.
Yeah, correct.
So it's going to be combination of Udirna, Samvara and Nirjara.
Yes. Correct.
I need to say that a very experienced man is asking me a question. So my brain takes a while to process and say that, okay, this is the answer. Well,
Okay, that's all. Thank you.
so Udirna is, so mujhe, I have very less learned the terminologies in Hindi, honestly.
Yeah,
So
that is the
sometimes I get stuck with the words. So yeah, just trying to tell ma'am that most of it is converting it in English and doing it.
Yeah, okay. Uh, yes. And what I was thinking now, this idea is so interesting. This concepts look so tough when we understand, when we try to take the literature and read through it. It looks very tough. And when you are just diluted this entire ideas, it is becoming so lighter. It is helping us to understand it in a clearer way. So I would just like to suggest you, it's all up to you. You can, just create one module or kind of document for the children so that they can learn all these things.
Yes.
You can just create illustration, like how the dental is using all these tools and all, and you can relate it to the all these theories, doctrines, karmas, metaphysical concepts, so they can understand metaphysics from a very
Much
young
better.
age. Like what is Jiva, what is Ajiva? Like at least they can understand about the Jainism, their principles, their metaphysics from very young age. Because it's very difficult to explain all these things to children. And they need to understand, because unless and until they understand who is Jiva, who is Ajiva, they will not differentiate between what is right and what is wrong. They will go on harming the individuals. They will not think that this is also Jiva, animal is also Jiva. So they will not differentiate all these things unless and until they understand that even our tiny particles inside our mouth, that is also Jiva. So I think illustration is going to work in a very good way to help them understand all these principles from a very, very young age. So you can go ahead, we can help you with the book you are going to publish or whatever modules you would like to publish. University can help us in bringing that to publications. You can plan it out, you can write out, and definitely it is going to be very interesting illustrative books, because I have seen that children like illustrative books a lot.
Yes, like
They just
Anil sir
love the
spoke about, yeah,
illustrations.
the gold standard example is that boat and the man sailing in the boat. I
Yeah.
mean, that is phenomenal. I think that is uncomparable, indispensable part of knowing what a seven tattvas are. And my son understands that better than the dental part. Because
Yes.
here he has to learn more. Boat is
Yes,
already learned in the
exactly.
LKG. Kindergarten mein boat kya hai, bacha kya hai. So all that is learned. So I think easier examples are more easier. So gold standard is what boat and sailing is
Yeah,
very,
exactly.
very
If we
nice
bring more
example.
examples like this concepts become more easier
Yes.
and well understood also. Yeah, so that is again a challenging task, but we all know that you can do it. Yeah,
I
yes. And
yeah, it's just all about
yes,
the
you think
time.
about it and you can do it. And yeah, I
We
was
all can do
thinking about when we were talking about our tooth and all this plague and all the karmas. I was like, so many of karmas we are storing every day. It's so much
it. Yeah.
challenging to get rid of all these karmas. But
Just
again,
imagine,
it's an
ma'am, brushing
interesting
every
point.
morning is killing so many ekindriya jeeves. We are talking about what? We are talking about so many things. I mean, the moment you put your brush and toothpaste, you're actually trying to destroy the jeev.
Mm.
That
हाँ
is
पूजा जी
multiplying in lakhs. And every time I take the brush, I'm like, oh my God. Every time I give antibiotics, I'm like, oh my God. I mean, every activity of mine is not towards liberating my soul.
Mm.
No.
इसलिए हाँ इस
So,
पूजा जी ठीक है इसलिए साधु जी ब्रश नहीं करते
नहीं करते हैं.
हाँ
But they
नहीं
end up
करते
coming to
इसलिए
dental field. As recently, I had 15 sadhujis up here, I mean, coming to my clinic, and I love serving them. So it's more of Vayavach. So this is what small way I try and, accumulate in me so that I take that punya in my bag. But these Mara Sahibs suffer that. They suffer dental treatment. They suffer dental problems. And then they come here, they take the dosha of me touching them, whether I'm in my menstrual period or if it's a male doctor, all the light, the fan, the instruments, the pani, which is not, I mean, whatever I try, the canals which are going through the instruments, drilling instrument, वहां पे पानी तो वही रहेगा ना, छाना हुआ पानी नहीं रहेगा. So in whatever way, so I think should it be brushing every day for Mara Sahib, or should it be this big pop together? So every day it's like little by little, you're not landing to a dentist. Landing to a dentist is like a bomb, isn't it? A lot of pop is coming together. Or is it better to brush every day? Or advise the Mara Sahib to brush every day. This is a small attempt. Brush, brush, brush. You're not allowing the bacteria to grow. I don't know. I mean, I always get confused, but I only say that uh, coming here is not a great thing. That Marasai was not ready to get the treatment done from a male doctor. But I know that male doctor is the one who is the right hand. I can't give her under standard treatment by calling any specialist who is a female. Of course, females can do a better job, but I don't know what is the skill set. So I had to force the Mara Sahib to do the treatment under the guidance of the male doctor. The male doctor had to touch her. She had to take that alochana back home, and she was only 3 months old in her Diksha period. She just took Diksha 3 months back, and she had severe dental issue. All this is so questions. So my brain is full of questions. Now somebody has to tell me, or I just have to go with the flow. But I feel that brushing every day is a better thing than going to dentist landing into bigger problems. Because here I'll be giving antibiotics, I'll be trying and using water, instruments, everything. So it's for layman also, whether it's you, me, or Anil sir, or Sandhya ma'am, or Swarupji. So end of the day, going to a dentist, you're doing bigger pop. You might as well do small everyday brushing. I don't know. Am I right on this or wrong? You will have to tell me your.
No, what I understand is that if you are brushing or if you're just doing the gargling and all these things, you're not actually killing them, right? You're just, you know, trying to bring them out from your zone. So you're
Yeah,
not killing them. I don't understand that. I don't
we
think
are
that you're
killing
killing
them.
them.
They
We
are
are killing
killed.
them.
They are
We
killed,
have
ma'am. They are
antibacterial
killed.
agents in the
Yeah,
toothpaste,
but
but we are not.
huh.
If we
Yeah, go
compare
ahead.
it to
You
the
know better.
water, जो अपन पानी पीते हैं धोवन पानी, तो
Hmm.
हमारे में क्या करता है, हम गर्म करते हैं पानी को, ताकि that what is that
Gene will be
36,450 microorganisms in one drop of water, isn't it? So when they try and multiply, so they heat it up so that एक बार में वो किल हो जाए, सो मल्टीप्लीकेशन ना हो. तो वही कॉन्सेप्ट अगर हम ब्रशिंग में यूज करते हैं, वी आर नॉट मल्टीप्लाइंग देम. एवरीडे ब्रशिंग इज नॉट मल्टीप्लाइंग द एकिंसिया जी वी आर डेवलपिंग बिकॉज ऑफ food getting stuck in between the teeth. A tooth is not a smooth surface. It is mountainous. It's got grooves, troughs, everything. So the food will get stuck. If you're not brushing in the night, you're allowing more bacteria to come and stay there, live there, make their shelter. सिमिलरली अगर हम पानी गर्म नहीं करते, महाराज साहब पानी गर्म करके ही पीते, क्योंकि एक बार में वो जीव मर जाते हैं, देन उनका मल्टीप्लिकेशन नहीं होता है. दिस इज व्हाट महाराज साहब टोल्ड मी. आई सेड आप जब गर्म कर रहे हो तो मर तो रहे ना जीव. कहते हैं कि एक बार गर्म करने से उसमें जो उत्पाद होता है, जो मल्टीप्लिकेशन होता है, वो कम हो जाता है. सो व्हाई कांट वी अप्लाई द सेम थिंग इन द डेंटल फील्ड? व्हाई कांट वी से महाराज साहब दैट आप ब्रश रोज कीजिए ना, तो आप मल्टीप्लाई नहीं कर रहे ना बैक्टीरियाज को, उसका numbers नहीं बढ़ा रहे हो ना, then you're not killing many together. So gargling of course will try and dilute it, or they try and go inside your stomach, and stomach में जाने के बाद भी your HCl is killing them. But that is your physiology. You can't control that. That is not in your hand.
Exactly.
Okay, all that will go behind your mind. But then what you can do, what is controllable, is brush, so that you're not multiplying the thing, but you're killing them in small numbers.
That is a very true thing, that you are stopping the multiplication of it. You're not actually killing it. There is a difference between these two both mentality. Rather than killing, you're trying to protect from it being grown further. So obviously there is a difference. Yeah. And one question was coming to my mind, like about identity. We have these identity issues a lot of time. And when I was studying and understanding identity more, and when I was listening to your presentation, this again stuck to my mind. Like you mentioned about the tooth, you mentioned that sometimes in a way that you try not to replace it, but sometimes it is like to reduce the pain, you have to replace it. Okay. So in that scenario, in that situation, we know that patient has to go through a lot of pain, sufferings. Obviously, you do it different way. The pain can be reduced, but that trauma will be there, that my tooth has gone, my tooth has been removed, isn't it? So after the removal of tooth, uh, do the patient carry the same kind of identity like before, or the identity might get changed when one of the important part of the body gets removed?
Yeah, so you have a framing for the teeth. So the identity gets hidden. Okay. So when you replace a tooth with the kind of technology, the lifelike appearance of the teeth looks so much in harmony. If I could present some pictures of the patient, you will feel that, oh my God, is this the way the replacement happens? पहले ज़माने में उतना technology नहीं था, but the identity of the individual is not breached, ma'am. The psychological trauma it carries changes their identity, but otherwise physically कोई भी identity change नहीं होती है. Of course with age you see drooping of skin, you see teeth losing. Those things, if they are replaced, nobody can know that these are replacements. Nobody. And the kind of fabrication of teeth, the kind of color match, oof, it is phenomenal. So the identity of individual goes down with the thing they carry home. So the first preface of our books talks about, even if the patient is 92-year-old, if one tooth can be saved, that is going to carry the joy with him, saying that mera ek dant hai yaar, natural wala. So that thing is what carries the identity for them. The inner feel, what they feel about it, is what carries the identity with them. Otherwise, replacements are big, so it does not allow them to lose their identity at all. Young patients, road traffic accidents, lose their teeth, we give replacements. Nothing. They go home happily. The trauma will be there. You मेरा natural नहीं है, but वो उसके अंदर है. अगर वो जताना चाहता है, he will show it. If he doesn't want to show it, remain bindas. तेल लेने जाने दे दुनिया. So it's something like that. Then it is different. So identity as such on a physical form can be replaced by a dentist.
Yes, yes, yeah. That's what physical identity you can be replaced,
Yes.
but obviously the mental
The
trauma,
mental
the
identity, yes.
identity, it
Mentally,
is
the
something
patient goes
difficult
through
to
a
touch.
kind of.
But you mentioned well about ahimsa then. You covered it very well, and
Yes, ma'am.
I think that identity could also be safeguarded if
Yes.
the practice
Physical,
of
mental, and
ahimsa
verbal.
is made as certain. Yeah, like you mentioned about the verbal ahimsa, mostly you mentioned about the ahimsa not to our panchendriyas. You mentioned
Yes.
something like that. It was totally new concept to me. Like we never think about this. Like yeah, we are hurting the panchendriyas. So that is
We are.
again a different thing we should be bothered about. So that is something new I learned in this presentation of viewers. So obviously not just these things, a lot of thing. I mean, a lot of new ideas, lot of new insights has touched me and everyone here about this topic, like how we
Yes,
can
ma'am.
connect this from our
Didn't.
livelihood professions.
I mean, I'm happy that you gave me a topic like this. I told you I'll do on moksha, and then you said no, 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 no. Do something which you can implement in your dental field. And it took me a lot of time. I'm really sorry, Areen sir, Sandhya ma'am, आपका exam का time है. I mean, हमारा मेरा भी है. So I'm eating up your time. I'm completely eating up your time. But
No,
मेरे
no,
पास
no.
बिल्कुल समय नहीं था. And ma'am, एक last, like you said, सूक्ष्म जीव and पंचेंद्रिय जीव. I mean, all of us are looking at Suksham Jeev. Take care of those. Take care. Are you have the Panchendra Jeev whom you're understanding. I mean, I always have this question to my parents saying that they are more bothered about pani ka wo jo channi dalna. Every tap has that thing. And there is a Kamali who is suffering, says that my child is not well, my child doesn't have education, my child doesn't have. How? What is that your main priority is? What you're seeing is what you need to do. Suksham is not seen. Of course, that's the base level. But today's era, if we are looking at somebody who is suffering, you might as well take care of them than, giving priority to this part, the one which is around you, mosquitoes, the uninvited pests. End of the day, what? I mean, I don't know. I feel Panchendriya Jeev, you are Panchendriya, you know what is like-mindedness, you know what is happening there. So helping them becomes more important. I don't know if I'm correct or right or wrong, but of course, literature will help me in future to apply this better. But right now, I make sure that every Panchendriya Jeev, whomever I come in touch with, I try and leave that joy to them. I make my every effort to give that joy. That's all. Whether it's a dental form, whether it's a revenue form, whether it's money form, whether it's anything, whichever I could do the best, I try and do. That's all I do. Otherwise, there is nothing that I do. I eat jamikand, I do everything. But on this note, I always consider that, yeah, there is a different routes for everybody, different ways of doing it for everybody. And Anekantavad applies more better here.
Yes, that is true. Absolutely, absolutely, you're right. There's a different way of practicing Jainism or any other tradition. It's all depends on you. It's all depends on your faith on it. So obviously you're doing it right, the way you're doing it. There's no doubt. And absolutely, we have to learn a lot from whatever you have shared, like how we can practice it in our life. Are we practicing? We have to question it again. Are we really practicing it or we are just learning it? So again, you have given us a
Stuff.
new insight that we have to look into it in a different way. We have to really start questioning us that how much we are practicing, how much we are aware of it, how much we can inculcate all this thing in our day-to-day life. So kudos to you. Congratulations. It was a
Thank you,
very
ma'am.
excellent and very nice presentation. Obviously, gave us a totally new insights, and we are looking forward to it. Like you may bring more to it, more insight to it, more reflection to it. I mean, share these ideas to others, because these ideas are not something should be kept just for the presentation. It is something which others should also know. So I'm sure that you are going to do something so that you share these ideas with others. You bring it to the other platform, other media, so that other people also know about it, learn from it, and practice it. So thank you so much, Pooja ji, for this presentation. We loved it, we enjoyed it, and we
Thank you,
really
ma'am.
got a new insight from it.
Thank
So,
you. I'm sorry, Anil sir, Sandhya ma'am. Please, I mean, आपका
नहीं नहीं
समय पूरा eat up हो गया, अभी वापस क्लास है.
नहीं नहीं
it
नहीं
was
नहीं
a
ऐसा
I'm
नहीं
sorry.
चलता
Yeah,
ऐसा
मुझे
नहीं
पहले ही
वो
करना था जब सब लोगों ने किया. Next year probably I'll try and be on time. And thank you, Vandi ma'am, for giving me that good number of days as a buffer time to do my
नहीं
job.
नहीं always you are
Sorry.
doing always your presentation is late ही करती हो लेकिन बहुत
हाँ,
अच्छा
late.
करती हो
अच्छा होता है।
लेट ही
नहीं,
करती हो
दो
बहुत
और
बार ही
effort-
अच्छा
हुआ है.
करती हो वो
नहीं, पूजा
डिफरेंट
दो
मैम आपने
semester ही
डिफरेंटली
बहुत
करती
एफर्ट
हो
किया होगी।
वो
नहीं,
ठीक है
एक्चुअली मैं
ठीक
समझ रहा हूँ कि
है
कितना
ऐसा
एफर्ट
नहीं
किया होगा उन्होंने।
हाँ हाँ
एक चार लाइनें याद आ गई, सुना दूं, दो इट इज आउट ऑफ
जी
टॉपिक।
जी
हाँ सर.
मतलब उसका सेंस ये याद नहीं आ रहा मुझे, मतलब वो है कि जो साज से निकली है, जो साज मीन्स इंस्ट्रूमेंट, जो साज से निकली है वो धुन सबने सुनी है। जो साज से निकली है वो धुन सबने सुनी है, जो साज पे गुजरी है वो किसको पता है। तो whatever the efforts you have put in, I mean that is
very
really
nice.
appreciable and I must
हाँ
appreciate.
We appreciate your effort, Pooja ji. Despite your all the professional things, you are keeping all this aside and bringing the best to this presentation, bringing the best to this journey of learning and sharing. So we appreciate your struggle. We appreciate your work, hard work, and efforts. Really.
हाँ मैडम
Really, it
Yes.
was.
it is purely different
Yeah.
Unique presentation.
different
Yeah. But I like
Yes.
that, Anil sir. जो साथ पे गुजरी है वो कोई नहीं जानता.
True.
Hopefully. Yeah. So one
वायर है
Okay.
बेचारा, कितना उसके ऊपर अत्याचार होता है वायर पे, लेकिन
हाँ.
सुनने में अच्छा लगता है, लोगों को अच्छा लगता है।
It's
तो जो आप पे गुजरी है वो
appropriate.
हम समझ पा रहे हैं।
You're the star of our batch. I can say that.
That is
No,
true.
no.
And yes, Sandhya
He
ma'am
is
is a
definitely.
different star.
नहीं मुझे
It's like
उतना नहीं आता
They are very regular,
those stars,
disciplined,
and then
नहीं
our whole
अभी
batch
सब
is.
बात है
we are all witness. We cannot like it cannot be like it cannot be proven wrong when we say that you're a star or something because we are all
Yes.
witness to it. We are all
Yeah.
watching you. We are all seeing that how much you give to this thing. Time, your effort, your
Yeah. The
ambition, all
time.
these things we are just witness to it. So really appreciating all of you. You are such a good
हाँ
student.
मैडम
I don't know when I can become like you, but definitely you are such a good students, all of you. So I'm pretty much happy that I'm getting such a good chance to learn with you and teach you. So that's also a gratefulness which I would like to reflect here itself that you all are so good and you always listen to us, give us so much of respect and give us so much of time to understand these philosophies, understand this metaphysics and all. So thank you so much, all of you, for the bottom of my heart that for doing so much for this journey.
The last word, ma'am. We are all good. We are all good. We are all good, but you are the best.
Yeah. So it's mutual.
हाँ
Yes.
मैडम हाँ
The
मैडम
teacher has to be the best.
Okay.
That's when the students will be good.
Otherwise, she is also best.
Yes, sir.
हाँ मैडम
The concept which I mean, she put in and asked
Yeah.
general discussions, very philosophical questions.
आप promote
Okay,
her
ma'am.
मैडम
Thank you. Thank you.
Yes.
you are promoting me as Hannah मैडम
Ji,
Yeah.
Sandhya ji.
हाँ
She's,
मैडम
she's saying you're
मैडम
promoting us. You're promoting
हाँ
us.
Obviously, we have to promote each other.
Yeah.
We have to promote this Jainism, most important, this philosophies, right? Yes. Okay, then
मुझे
we
तो
will just wind up.
मैडम मुझे तो ऐसा थॉट्स नहीं आता मैडम
सब होगा
Ma'am.
Sandhya ji. We just have to be positive.
मैम
Right?
कोई भी
Dr. Pooja
चीज
is here.
कोई भी चीज हम 300 घंटे करते हैं. There is a book which I just thought I'll mention. 300 hours. Anything, any human does it for 300 hours. You become a master in it. It doesn't matter you carry the skill or no, but you do it for 300 hours. Then you are mastering the skill. और हमने ये in and out किया मैम पोस्ट ग्रेजुएशन में. Presentations तो हमारे ऐसे बड़े बड़े podium पे रहते थे. It's become like in and out. So any activity, if I want to become a Mara Sahib, I live with Mara Sahib for 300 hours. I'm going to take the skill. मस्त है बुक, मैं आपको लाके देती हूँ. कन्नड़ा में नहीं है. ये कन्नड़ा में बहुत अच्छा समझते हैं एंड शी एक तत्वार्थ सूत्र बुक है मैम इनके पास, इट्स रियली गुड, बट मेरा कन्नड़ा इतना स्ट्रांग नहीं है. या well but 300 hours
मैं
sir
सिर्फ
ये
कन्नड़ा
proven theory
अंडरस्टैंड कर
है
सकती हूँ
according
ना।
to science that anything you want to learn drawing you do it for 300 hours you become a master in it. और हम सब लोग क्या करते हैं, थोड़ा सीखते हैं and then we leave it saying that okay
Leave.
मुझे आता है, but you do it continuously for 300, not like sitting all day 24 hours 24 hours, ऐसा नहीं है. दिन में
ऐसा
1 घंटा भी अगर हम consistently 300 घंटे देते हैं, so it takes about 90 days according to the book. It says any activity to be inculcated and become a master in that skill, that 300 hours you spread around 90 days, you become a master in it. If I learn Jain Metaphysics for 300 hours, I will not become less than a master for myself. So anybody can, any human brain can do it, but it has to do it for that number of hours to master the skill. So ma'am, हम दोनों करते हैं.
True, we will do. Absolutely करेंगे. Okay, चलिए, we will meet in the next class. Okay.
हाँ मैडम.
Thank
Jai
you, ma'am.
Jinendra. Thank you so much for
Okay, Jai
joining.
Hind.
Jai Jinendra.
Jai Jinendra.
जय जय